Hi, just getting this camera set up a little bit because I'm doing something a bit unusual. Just a few moments ago, I recorded what my knee looked like. The nurse happened to be in here, and I showed that. So that was part 6. This is part 7. And I just wanted to document my last day here in the hospital, what I'm able to do walking-wise. I mean, I have some crutches on the back of my bed, and I can get around quite well with those. But I also wanted to show just a bit of walking, so just to see what um, a sample size of 1. It's just me again. What I'm able to do after 6 days after the operation. And I've been walking each day 3 or 4 times. We've got a little lap of a thing that takes about 1 minute to walk on my crutches, and I've been doing about 6 laps of that about 3 times a day. So let me just go ahead and get to this part about the walking. And you can also see these great white things on my leg here, the support hose looking things. So I'm walking quite carefully, as you can see, trying not to put any sideways movement. You know, I'll skip showing the crutches. I mean, it's just somebody walking on crutches. How interesting is that? Not. So, okay, so let me get back here and address a few more topics that I want to make sure that I talk about in this clip. And that is, after your operation, most people aren't hungry. And I was a bit different in that, as I was hungry because I had surgery at 8 o'clock in the morning. I didn't have breakfast, and then it was approaching lunchtime, and so I asked, hey, when can I eat? And they were like, oh, gee, most people aren't hungry after surgery. And I don't know. So yesterday afternoon, there happened to be some chocolate cake near the nurse's station, and they said, yeah, that was for the patients who had the surgery, but they didn't want it. So I didn't want it to go to waste. And it was chocolate, you know, and cherries in it, so it was pretty good. Some other topics I want to make sure I mention. The medication causes constipation. I think I might have mentioned this briefly. So I'm usually regular as clockwork, and all of a sudden, you know, the time in the morning that passes and I haven't had any kind of a movement. So I thought, what the heck is going on here? And at first I didn't know. It's just the more that I read about it, the more that I found out, okay, it's just a side effect of the medication. And the other thing is, yesterday I had an ultrasound done on my legs. As I showed you the great white hose up here, support hose, is up to mid-thigh. And that's one of the things that they do to try to keep you from getting some kind of a thrombosis problem. In 2001, I was on a long airplane ride, about 12 hours, didn't get a chance to move out of my seat, and ended up with a problem like that. So they want to know your history of thrombosis, so really think hard. I couldn't think of that one at first. I'd forgotten about it since it had been so long ago. But anyway, they do an ultrasound and they push hard into your leg. They're supposed to do that to see if any dark area will squish up, which shows that it's a vein or something normal. So expect that also. And that's the only topics I can think of. I just wanted to make a quick summary as I'm leaving the hospital. Other clips that I might do in the future is just to document my mobility. Again, it's only a sample size of 1. You're just finding out my experience. It's not what's typical. One thing that I have been complimented on by the doctors is that I was fairly fit coming in here. So I did have an exercise program that I was doing, working out in the weight room. That's actually my job, is supervising a weight room. So what the heck, I might as well do all those exercises as well. And so that did help. And a lot of bicycling before. And hopefully I'll get back on the bicycle soon. It's supposed to be 4 weeks. I'll give you an update on that, on how soon I'm able to get back. I'm hoping in a week I'll be back on the bike. I'm being very optimistic here, and that's what I'm going to try. So I'll see you later, and I'm taking the train home back to the Netherlands, and yeah, the train's going to help me move my luggage and stuff. I just had to call ahead. That's another thing. You can call ahead and get extra attention. You have to prove that you're handicapped. In this case, I had an operation, so I don't really have proof. I mean, I do have my certificate that shows that I do have an implant, and paperwork from the hospital, but the nurse called, and so that really helps smooth things out. And so, yeah, I'm taking the train home. So, again, bye.